Still with me? So here's my rules on treating somebody that has moved beyond the chronic stage and into the autoimmune stage. And how do we know that? Well, we can test for it, but how would you know that not coming to me? So, how would you know that? That is, the biggest way that you would know that you're in an autoimmune stage, well, let me save that question for just a second, because as I explain this, I'll answer that. So this is my rule. If a person is autoimmune, they are stuck in either, remember I said there's Th1 and Th2 side. They are stuck in either a Th1 dominance or a Th2 dominance. Symptom-wise, a person that has a very aggressive disease that is very debilitating and it's causing a lot of neurological issues and it's progressing fairly rapidly. Pretty good thing, this is what I tell doctors, pretty good thing to guess is they're Th1 dominant. Now it's really important to know that because it guides your treatment. If a person has cancer, and this has taken 20 years to finally surface where they have a diagnosis, it's not like really acute, it's slowly debilitating and could kill them, but it's slower. Pretty good chance they're Th2 dominant. Matter of fact, I write in this book that I think all cancer patients are Th2 dominant, but that's my opinion. So there's a difference, and you've got to treat these people differently. Number two, what are or what is the primary antigen? And you know, if you've done any study, any homework on Lyme disease, there's about 100 different co-infections that go along with Lyme. So you got to know what we're dealing with as the antigen. Remember, the definition of antigen is that's the name that we give whatever pathogen that the immune system is turned on against. So if I have a virus, and it's a cold virus, and my immune system turned on against it, we call, in immunology, that cold virus an antigen. So what is the antigen? What is the thing that the immune system has turned on against? Okay? So, now, this is a class on Lyme, so we're assuming that we already kind of know what the antigen is. It's Lyme and it's co-infections, right? But there's lots of people that come to us that, you know, they've been everywhere, nobody can figure them out, and it's not Lyme, they have an autoimmune disease, and it's some sort of other pathogen that we have to figure out what it is. But you do have to know what the antigen is that you're dealing with. Number three, where is the concentration of the destruction? Remember, if my immune system turns on against a virus that's in my body, that virus can be concentrated over a period of time in certain areas. Lyme disease, you've read, maybe some people, you know somebody who has Lyme disease who has joint swelling and joint issues and arthritis, and that's their primary concern, but they don't have any neurological issues. And another person doesn't have any joint issues, but they can't remember anything anymore, they have brain fog, they have balance issues, it's affecting their cerebellum, their temporal lobe, their frontal lobes, and they have all this inflammation in their brain. Where is the primary area of destruction? So the primary area of destruction is going to tell us where the antigen is located, and you've got to treat that differently. Next, how are we going to get rid of the antigen? Well, that's the question of the day, isn't it? How are we going to get rid of Lyme disease? This gets back to that first piece. Is the patient Th1 or Th2 dominant? If you've already moved to an autoimmune disorder and you are Th1 dominant, there are certain nutraceuticals, you know what I mean when I say nutraceutical, right? An herbal or a vitamin or a supplement that you could take. Some supplement that you could take, right? There are certain things that you could take or foods that you could eat that are going to stimulate a Th1 response. And there are certain supplements that you could take or foods that you could eat that would stimulate a Th2 response. Now it's very important to know If I have a Th1 dominant Lyme disease, I don't want to take supplements that are going to stimulate my Th1 side, because my Th1 side is already out of balance. And what does my Th1 side primarily do? Kills things. So if I'm going to take vitamin C is a Th1 stimulator. I am going to help my body kill itself. So if I'm going to take anything that will stimulate a Th1 response, when I'm Th1 dominant, I'm going to be aiding the destruction of my self-tissue. Follow me? Pretty important. This is the question that we get on the phone. Well, I started this vitamin C protocol and I felt better for the first week, and then it's just like I went straight downhill. I felt horrible. I felt worse. Pretty good chance this patient's Th1 dominant. I started on cat's claw and garlic, and I thought it started feeling better right away, but then I just absolutely crashed. Pretty good chance this person's Th1 dominant. There are a list of Th1 stimulators in my book. You can download it for free. There's a list of Th2 stimulators in my book. Most of the time, you look at any multiple vitamin, it's going to have Th1 stimulators on it. Anything that will stimulate an immune response, any supplement that's going to be an immune stimulator is a Th1 stimulator. So a Lyme patient, an autoimmune patient, I don't care what kind of autoimmune disease it is, that is Th1 dominant can't be on any of that stuff. Okay? Very important, because you think that you're herxing, and I want to go through this herx because I just got to get through it and I got to kill this thing, and you're just destroying your body. Can't do that. Well, how are we going to kill this thing then? We'll talk about that. Most patients that come to me that have chronic Lyme, quote unquote, they already know they have it, are Th1 dominant autoimmune. Or they wouldn't come to me. They're already doing some herbals with their chiropractor or naturopath or whatever. They've Googled some information and they're doing pretty good. They don't need me. And how are we going to address the rest of the body? That's very important too. Because let's say if a person has all these neurological symptoms, they have inflammation in the brain because of the pathogen, let's say it's Lyme disease, and they have this autoimmune Th1 response. Every time their immune system fires, that's the irony of the thing. It's actually when I feel better is when my immune system is completely fatigued. And when I feel worse, it's when my immune system has got the gumption again and it's going to go out there and kill that little bugger. That's when I feel worse, because what it's killing is not that little bugger, it's killing my neurons. Not good. So you still have to, as a doctor, you got to look at how's the liver detox pathways, how's the kidneys functioning, how are we going to heal the blood-brain barrier, how are we going to heal the leaky gut issue, how are we going to get the inflammation out of the brain, how are we going to rebuild the pathways that the immune system has already destroyed in trying to kill the Lyme pathogens. We got to rebuild the neurons. There's just a lot of stuff to do on a Lyme patient.